How do you fill a practice with patients that you absolutely love working with? We're going to cover all about that today. If you're new here, my name is Alysha. I'm a psychiatric nurse practitioner and I own my own private practice, and I teach other psych NPs how to find freedom and balance in their lives by opening their own practices as well. Today we're going to talk about how to pinpoint your ideal client and steps on how to learn more about them and then ultimately help them find you. I think that this is a complex area of marketing because it's not organic to what psych NPs usually do, which is just show up and see patients. But we all have those patients that we love working with, and we all dream of a practice where we could have almost a full practice of the patients that we love. So the way I'm going to teach you how to do this is going to be in 3 major steps, okay? The first step is pinpointing your ideal client. And I want you to think beyond the diagnosis, okay? A lot of people, when they think of their ideal patient, they say, oh, I love working with patients with PTSD. But there's a lot of different people that have PTSD, and there's a lot of different ways that PTSD can happen. And so some patients you may love working with that have PTSD, and some you may not. And so why is it that some of them you love working with and some of them you don't? This is not to encourage shunning or being negative against patients that you don't like working with. Usually we don't like working with patients that we feel like we're not equipped to work with, right? And so that's a sign that they may find better care elsewhere. And I think that it is incredibly compassionate to direct patients to a provider that specializes in that and loves working with that. And so we cannot be everything to everybody, right? So when you're pinpointing your ideal patient, I want you to think all about their demographics, not just their diagnosis, okay? So I'm going to give an example on this. So I want you to think about their diagnosis, but also their psychographics, like what are their values? What's their lifestyle? What's their motivation? And ultimately, what are their pain points? So you want to know all about this type of person that you love working with beyond the diagnosis. So let me give you an example. You may say, I love working with PTSD. Then as you work with PTSD more, you may say, I love working with individuals with medical trauma. Okay, let's talk about that. What type of patients do you like that come with medical trauma? Let's say cancer patients or survivors of cancer. So then what type, right? What age group? So maybe you like working with young adult individuals with cancer or past cancer diagnosis and PTSD. What are their values? What are their motivations? Maybe it's something like, I want to get back to the old me. I want to get back to the old me that I was before, like challenges with identity. And then they may have challenges with grief of a loss of something, you know, if they've had like a mastectomy, that's a physical loss. If they've had, loss of income because of their cancer diagnosis, or they've lost friends because people weren't there for them during their cancer diagnosis. So let's take this type of person that you like working with, right? Young adult cancer patients that are grieving, missing their old selves, right? We're covering some pain points as well. What motivates them? What pains them? Why would they come to you for help? And it's important to do this because this is going to help your marketing. This is going to help how you talk to these patients. I say talk, meaning what you put on your website, okay, is incredibly, incredibly important. So some individuals that where this is their ideal patient, they might put that they work with anxiety, depression, PTSD, but that could be, really broad. But if you say, I work with young adult cancer patients that are struggling to find their old selves, struggling with grief, struggling with the loss of income, struggling with the loss of friends, this all paints a picture to your ideal client that you are exactly the type of person that would want to see them. Some may think that being this narrow with your niche turns people away. I guarantee you it doesn't. You will still have patients calling you that have all types of PTSD. You will have patients calling you that are completely outside of your niche or completely outside of the type of patient you see because you're local to them. People are still going to reach out and you can still decide if you want to see them or not. But what you're trying to do is attract the majority of patients that you feel best working with. Then once you know their demographics, psychographics, values, and pain points, then we get to stage number 2. And that is, what are the pain points that you are trying to solve? If it's grief, this may be, you may be trying to help them with depression and SSRIs, or you may say something to the effect of, I help young adult cancer patients find a medication regimen that makes them feel more at peace or lessens their reactivity during procedures and scans, things like that. That's very, very specific to their problems, right? A young adult cancer patient might come to you saying that they have panic attacks every time that they go to the cancer center. They may be coming to you saying that they have nightmares about cancer treatment or nightmares about surgery. And so you specifically identify these pain points that you can help with, right? In PTSD, we can help with lessening reactivity through certain medications. We can lessen depression and anxiety through certain medications. So speak to that. In your website, speak to those specific pain points, okay? Because then that's going to make them read your website and they're going to say, wow, that is exactly what I need. That is exactly what I'm looking for. And it's going to draw your ideal patient to you. Then stage number 3, this is when you already have some ideal patients in your private practice. You are going to identify who those patients are, who are your patients that you absolutely love working with. And then you're going to do an assessment and figure out how they found you and what resonated with them so that you can then do more of that. So you might say, which therapist recommended you to me? You might think, where else do they spend time? Do they spend time at the young adult cancer center support groups? Should I pop in there and see if I can post a flyer up about my services? Basically assess where they came from, how they found you, and assess the other places that they go so that you can get in front of more people that are just like them. All right, that's all for today. Those were huge, huge concepts in just a few minutes. And so I want you to really, really think about those 3 stages. First, think about what stage are you in right now? And then second, think about your current marketing or how you conceptualize your ideal patient. And I want you to think deeper. Journal about it, write about it, whatever you do to get those thoughts out. Get those thoughts out, figure out your ideal patient, dig deeper than diagnosis, and I promise you this will help your marketing. All right, guys, I will see you in the next video, and please drop a comment below if you have any questions about this. I do check my comments. Make sure to like this video and subscribe to my channel. It really helps me make even more content for you guys when I have as much support as possible. All right, I will see you in the next video, and happy practice building.